try to cover that information tonight, and then if you feel like you didn't get enough information, we're certainly willing to come back and meet with people individually and talk to you. We can set up those times. So I'm Rosemarie Rosati. I'm the Chief Operating Officer for UBHC. This is Rena Gitlitz, who's the administrator for the program. Jonathan Oletabosin is the supervisor, and Christopher Kosif is our CEO. So I'm not sure how you want to start. If you want to ask questions.
Maybe you should start.
Tell us about your program.
Okay, so UBHC has been providing residential services for many years, more than 20. And we've had this program for just about as long in another location. We were in a location where we ended up having to relocate, and it made sense to buy property so that we wouldn't have to do that again.
Why here?
Why here?
Yes.
Yeah. So we looked for a very long time for a house that would be large enough to have enough bedrooms and common space and space for the staff. And unfortunately, the largest houses are in developments like this.
How about
We
in
tried.
Camden, where Rutgers is? There's plenty of homes in Camden.
Or New Brunswick.
Yeah, how about
Or
that?
8 towns between the
How
two.
about the one where it's quite where
Better
you
explain the
have
program.
triple the square footage.
Okay, so we do have a similar program in Middlesex County, but this program was funded for this county, and that's why it's located not in New Brunswick.
I'm here to say that I believe, I don't have specifics to tell you, but I believe you can get double the square footage for what you paid for that in any number of places that are mostly commercial.
Commercial.
Mostly
Okay.
commercial. They're zoned mostly commercial, not residential.
Question. Did you purchase this on the short sale?
Yes.
Yes.
You did, yes.
For $255?
Yes.
Yes. Was that
Well, why do you
something
know
that
that?
handed
That's important to
between
know.
you and the realtor?
Why wouldn't you know that?
Did that go out on the open market for other people would love to be living?
It was on the
Yes.
open
For
market.
Not as a
250?
short sale, it wasn't.
Yes, it
Not
was.
as a short sale.
It was. I'm a realtor, and yes, it was, but there are thousands of homes I could have showed you or your company that are bigger than this, same price in the
Okay,
area.
so we've
nothing was
established
question.
that the size is not the issue. The size was not the issue in your selection.
So can you tell us why you chose this neighborhood?
Actually, we looked for a very long time, and we did work with the realtor, and it was our facility
Which
people.
realtor sold you this house?
Yes.
Oh, I have it.
Well, we can get that.
Yeah, you can find
No
out.
one knows that. No one
We
knows.
can find
contacted
that
that
out.
realtor at his home, and he said that it was to be a home for professors, visiting professors, that were going to be staying
The
here.
realtor said
The
that?
realtor said that.
Well, who
And when
said
he
that on
asked,
record?
he asked where we got the information it was going to be a group home, because he laughed, he said that was so ridiculous.
What type of people will be living here?
And how
Yeah,
many?
that's a good
Question,
question.
please, why this neighborhood? What is the demographic that you're interested in?
It was really the county and the size of the property, although you don't believe that.
It's not that I
Yeah,
don't believe
was
it,
the
it's
number.
fact.
It was the number of bedrooms that we were interested in.
How many bedrooms?
4
4
bedrooms, I could buy you 5 bedrooms.
Did you take into consideration that the children walk by the house?
School right there?
No, I wasn't.
Okay, so you were unprepared, not us. You were unprepared.
Okay, why don't we hear what type of people
Yeah,
are
we
going to be
understand
living
that.
here?
Right,
Can't
that's,
answer people yelling at us. We need one person at a time.
how many
I'm not arguing, I'm
So the program is licensed for up to 8 individuals.
And what kind of individuals?
These are people with mental health problems.
I'd like to know what kind of.
sexual offenders.
You guys have group homes in your neighborhood. Is there a group home in your neighborhood?
Yeah, do you have a group home?
would you like to-
Sir,
I want to know that.
It is either.
You don't need to keep yelling. It's
Okay.
not gonna help.
They want to know if there's going to be sex offenders.
Coming back and forth from these two developments all the time.
there's no busing here.
I would like to know the wide spectrum.
Even if they give you a notification.
Can't hear you.
These are all people who
We didn't hear you.
has screened and determined
Can't hear.
our
In a community where we have children that walk right here
And
and
no busing.
that live alone.
You're damn right. I don't want this. My granddaughters are moving into.
And every day there's kids out there fishing, right?
All summer long.
I have a 10-year-old son who the reason we moved here was because of
Is anybody from the neighborhood involved in that screening process?
Would you like this in your backyard?
Be fine with me.
I don't think so.
I bet he's got a nice big house in his
neighborhood. These people are our children who are going to be living here. These are not animals. These are not bad people.
I have visited Ancor and I have visited Lake Land, and I know what is in both of those. Okay, and that was one of the two places. I don't know what other
Are you a
places.
tax exempt facility?
Yes, they are. Oh, yes, they are. Oh, yes, they are. Okay, can I get back to what I was saying? Okay, I have visited the places that have been mentioned.
It's too late then.
And I already know what comes out of those places.
You mean who comes out of those?
Who?
They're not what?
Yes.
They're not animals.
I have a friend who works at Ancora who's been beat up many times as a counselor.
Autistic.
So they're not
Okay,
normal
so
people.
I really understand that there are places that people need to be. I understand there are places that people have to go to get back into society. But is a cul-de-sac here with children
In Berlin.
in Berlin, and where are these people supposed to go? Where's the bus?
Why don't you put them in a senior citizen community? Why would you put them in a community? There's a lot of communities that don't have littered with children.
See, he didn't even respond to what I said. He didn't even respond to what I said.
Well, thank God people are taping it.
Excuse me. Please, one at a time, because the man can't answer. Please, one at a
Well, he actually isn't answering most of the questions anyway.
Only the
Didn't
ones you
answer
like.
mine.
Chris, did you answer one?
I'm not sure what your question is.
Well, I was talking about, I understand and respect all individuals, okay? But there's a place where
What is this meeting for anyway? Where's the township? Where is everybody?
this a place.
What do you mean they don't care? They're not. Don't you have to be zoned to get a house to have people in there? They got it all zoned.
The state supersedes everything. You think so? The state can overrule
Such a creative legislation.
I'm speaking. If you lived in that house right there, and you had a 10-year-old child, and there was a pedophile that lived right here, how would you feel?
These are all people who the state of New Jersey has.
It's a standard
I feel
answer my
fine.
question.
I'd actually feel fine.
Guaranteeing there's no place to
in this house. That's what
I am telling you that the state of New Jersey is.
It's a standard answer. He's not saying anything.
No, he's not answering the question.
I can't tell you who's.
You're a good politician.
That's the state.
Well, you guys are putting this here.
Nobody.
Does he have a
From
car?
Rutgers. There's nobody.
Wait a minute.
I have a legitimate question. Do you know what the DSM-5 is?
Yes.
Okay. So, now, you know, okay, what that is, the mental health, that's a book, the psychiatry, that's what everybody goes to when it's in core. I'm a nurse. So that's basically what everybody goes to look up all these behavioral issues. Now, my problem being is, basically, if even there's a drug addiction or whatever, the saying being is when they short circuit, if it's a drug addiction, it is like hijacking. They don't know which way to turn. They have a problem. It's like hijacking. Okay? Now, this is out of your own professor's book. Here it is, out of Rutgers. Chairman, right here. Do you know that?
I don't know what you're asking me. About hijacking? I don't know what
Well,
you're
you
talking
didn't read
about.
your own professor's book in Rutgers, sir.
What's hijacking?
The
Hijacking
circuit of the brain.
When it stops, when they fail,
Behavior
they're
addictions, right out of Rutgers. And you want to know who the person is?
What is your question?
Yes.
The bottom line is, we can't guarantee our safety.
when somebody fails their success in trying to rehabilitate, which happens often. Like I said, my daughter has worked with brain damage, She's worked in short-term and long-term facilities, and there is a lot of people that just fall. They don't succeed, and that's what you're talking about.
Exactly. Who's going to manage this? Who's going to, when they short circuit, or if that happens, who's going to watch this? Who's going to manage this? Is anybody going to manage these?
Okay, I'd like to speak to some of the questions.
All right, let's hear this. Yeah, please.
We all hear your concerns. Why did we come here and not somewhere else? You have young children, you have a swimming pool here. You have people moving in who have disabilities, who need to have supports in the community. I think you're going to have a lot more questions than we could deal with here. But what I would, and we'll come back and meet with smaller groups and people individually. We'll be happy to do that as many times as is necessary. What I'd like to speak to right now is to answer some of the underlying questions that some of you have that we can answer. In terms of
when are you going to give up? There you go. When are you going to not do this? Don't be rude. When are you going to realize this is not acceptable in this neighborhood? This is a cul-de-sac. I do, ma'am.
In terms of the actual,
We don't get any traffic down there.
in terms of the actual structure.
There's no traffic down this end of the.
Why do you think we bought in a cul-de-sac?
Oh my gosh.
Oh, he's raised his hand back there.
It's been up for about 10 minutes.
No, I just said, yeah, back there.
Oh, they don't get visitors.
In terms of the structure of the actual program, this is a 20.
My number one concern is, just recently in the last couple of years, I started instilling in my children how to be safe within my own home. When my wife and I would leave the house, I'm scared to death now, as a parent, to leave my children by themselves during the daytime, let alone the nighttime when we're not there, stay within the house by themselves. What kind of guarantee or security can you give me as a parent?
So this is I hear you. This is a program that has staffing on site 24 hours a day, 7 days a week.
That's bullshit.
There are a minimum of 2 staff on site all the time.
What other qualifications? How much rent?
Yeah, go ahead. Don't worry.
I will.
I'm
gonna go babysit.
Up to 8 people. There are 2 people on staff all the time that are trained, that meet the requirements of the state for the position, and that go through UBHC's training. We have
New Jersey State Department of Corrections.
We have a full-time nurse on staff, an RN on staff.
If they're stable, why do you need a nurse?
Good question.
Seriously.
Ask it again.
Ma'am, if they're so stable, why do you need a nurse and a doctor here? If they're okay.
Because a lot of people have medical conditions.
Oh, they do.
What kind
And
of
because they fall
Exactly our
off.
point.
What kind of condition?
I can't speak, I can't give you
Why is that so
specifics.
secret?
My point is that we have professional staff
Why
on
is it such a
shift.
secret on who's going to be coming into this house?
It's not that it's a secret, it's an issue of the law and disclosure. So,
Do you have to share your personal health information with this group?
all right, if you
But I
want
will,
to
because it's nothing crazy.
If I was doing something that, if I would do something that would risk the health of this group, yes, I would do that.
I'm all about helping
we
people.
provide transportation. We have transport for people to go to and from
There's
the
not even a bus
residence.
around here for them.
They are not
There's nothing here.
unsupervised. That's
What they got, the Berlin auction?
The program is to provide supervision and
sex
to give
offenders
people
have
the
to,
supports they need
is
to
being
live
announced
and
to-
Yeah,
learn
they
how to
do.
live independently.
So,
The age is 18 and over.
What about
So
criminal
they
history?
know who's gonna be living here, obviously.
I called there today. It's
How
not,
come you can't
sex
tell us
offenders is
who's
not really,
actually
it's
gonna
all
be living
people
in
that
your
are
house?
literally crazy.
You're going such a wide spectrum from schizophrenics that have stopped taking their medication.
We're not asking.
That's what it is. The nurses, if they don't take their medicine, they could go crazy. There's 8 to 2.
And do you know what happens with those? My daughter works with those. Okay, she's at a table. She has to have a whistle, and she has to have access access to a door to get out
Mayor, is this properly zoned?
because it's not safe.
There's no zoning. They're human beings. Is it a group home or a boarding facility? What does it zone as? The zoning permit. What's that?
Residential.
No, what does the zoning permit say? What kind of group home? It has to be classified as either something boarding. Is that part of the American tradition? What does the zoning permit say?
Can we go in the house?
Because I believe the majority. I believe, don't walk away. I don't walk away. Well, you just told me.
Gray coat, not speaking.
Well,
Who voted him in?
the other thing that you don't realize is it's going to be a constant turnover, because when somebody succeeds into where they feel they need, they're released and somebody new comes in and it's a start over.
I can't get a word in edgewise. I'm in the townhouses over there. I pay $9,000 in taxes. Why would I have to pay that much money
We're
for
also
taxes for
paying
this?
condo fees. Well, we're paying, yes. Okay, so they're exempt from that, they're exempt